Good morning, everyone. I'm Karen Cornish, Operations Manager for Amada Senior Care in Williamsburg. And I want to thank you all for being here today for the first in our series of Knowledge is Power webinars, the senior care options during the coronavirus. Our speaker today is Jay Mann, franchise owner of Amada Senior Care in Richmond and our new market here in Williamsburg. Jay?
Very good. Thanks, Karen. Thank you all for being on the call. We are living through a very unique time in world history, and that certainly affected all of us in different ways. Most specifically, our loved seniors and the market that we're serving. So we felt like this was an important discussion to have. I know that there are a lot of questions out there with respect to how do I help take care of my loved one, my parents, my grandparents, or you may be the person themselves that need help and you're not sure where to turn to or what to do. So this was a topic before COVID. It's even more of a topic with COVID. There's a lot of apprehension and concern around it, and I want to address some of those questions. Normally in a discussion, I invite a discussion, but because we're all spread out throughout the country on this call, let's get through the presentation, and then we'll be happy to answer questions at the end. So again, I'm Jay Mann. I'm the owner of Amada Senior Care, serving the Richmond and Williamsburg markets. Just a little bit of background, who Amada is. Amada is a home care agency, a senior care agency. Our mission is to enrich the lives of those we serve. We do that through providing home care aides, licensed and insured, into people's homes, trained. We also help with respect to identifying and finding the right senior living community or senior living environment for our clients. We help with financial care coordination, helping to understand the funding sources such as long-term care insurance, veterans aid and attendance benefits, etc. Amada Senior Care is a national organization founded in 2007. There are over 130 locations throughout the country. We've established an excellent reputation throughout the country in terms of what we do from a quality and care standpoint. Just to give you a little background, our location in Richmond, Virginia was the 30th location in Amada. Franchise history started in 2014. So our goal today is more and importantly about the resources available to you. We want to be a trusted resource for the community. We want to have resource guides that you can refer to easily, come back and understand. We have a tradition of helping not just the seniors in the community and their families, but the partnership communities that we work alongside. It's very important to us that we collectively are all doing the right thing and spreading information so that seniors and their families have the resources and know where to go to get the resources that they need to make their best decisions. So moving forward, just a quick bit of housekeeping. As we were hearing earlier, please mute your phones or your laptop if you are receiving this transmission through your computer. Please save your questions till the end. I will be happy to answer everything to the best of my ability. You can message. Karen's going to keep track of all the questions through the messages. And as you probably heard, we are recording this. So we have a YouTube web channel, Amada Richmond, where this will be posted so you can go back and review it at another time. So moving forward, the webinar is being recorded. We know that. I want to talk about 5 different areas, 5 different bullets where we have seen, we've fielded a lot of questions, questions that we have ourselves and we feel like need to be addressed. So what are the factors that are impacting the senior community? These are factors that impacted the senior community before COVID-19. Of those factors and why that group of our population needs additional, care and options for them. What are the options? And that can be very confusing. We work with people that are very, very successful, very talented, very intelligent, and they have no idea how to help their parents when that time comes. And so we want to get them the options that they need. We want to help them understand what those are. How has COVID-19 affected these options and the senior care community? And then what has the senior care community done as a response to COVID-19 and how to work within its confines? And then finally, a question that's always important is, how do I pay for this? And so we'll talk about all of those. So the factors impacting the senior community. There's a term out there called the silver tsunami. What they're saying is that the senior population is the fastest growing segment of our population. And so, and that really creates a lot of questions. How do we, if there's more and more people that are becoming seniors and they have lesser and lesser capacities, how do we take care of them? How does our healthcare system accommodate, their specific needs? So, back, between 2000 and 2020, today, it was predicted that the 85-year-old age group would double in size, reaching approximately 70 million people. Well, if that current trend keeps up, there's going to be 19 million people in that age range, just 85 and over. So how do we take care of that population? Further from, along that line is that of people that are 55 and older, this is back from a 2000 AARP survey, 89% of those people 55 and older said that they strongly agree that they want to stay in their homes. They don't want to leave their homes. And then further, once they get, for that age group, 75 and older, 95% of the people said that they wanted to stay in their own homes. So as professionals, we need to be able to work together to accommodate those needs and understand, what that situation may be. How does that work? And there are a couple different options, and we're going to go into greater detail about that. But there, certainly senior care communities, assisted living communities can fit that need. But if there's a national trend toward wanting to stay in the home, that begs other questions. It's known that, it's approximated, I would say, that 75% of the people that need care currently are being administered by a loved one. Well, if you go back to the 1940s and 1950s, the people who are now the baby boomers, those families had on average, 4 children. Well, now we just saw in the previous slides that more and more people are aging every day. So you've got, we're going to have 3 times the number of people that need care. And now the trend is that people are having, families are smaller. So on average, they're having 2 children. So we can have 3 times the number of people that need care with half the number of people that were traditionally giving that care. Additionally, the families, have other obligations. They love their families, they love their parents, and they want to help them, but they have kids of their own, they have jobs, they might live in other parts of the country. So it creates, and this is all pre-COVID. These were challenges before COVID-19 came, and the way we worked with families to help them navigate these waters was to look at what some of these senior care options might be. So, what's the first option? I've said it, ad nauseum at this point. First option is to stay in their home. We don't want to leave. Another option can be to downsize. Maybe their current house is too big. Maybe it has 2 stories, their bedrooms on the upstairs, and they can't navigate stairs any longer. So they downsize into a smaller home or an apartment. We could move to an assisted living community, and there are pros and cons associated with that. Very strong reasons for the right fit, and we can talk about what those are. We can move in with family, yet another option. I've done it myself, and I can speak to that. So, let's break it down a little bit more. Let me just emphasize, though, that none of these options are a one-size-fits-all. Many of these options can be brought together and can be a combination. And I just say that it's important to work with a senior care professional, and they can help with the pros and cons. They can help with the cost analysis and give you and I'm sure in this audience there are people who both need the help, and there are professionals within our community. There are partners. Again, our goal is just to provide information that can help you with those decisions, and working with professionals that understand the pros and cons and the costs can help give you that data. So living in your own home, I spoke with at first. A lot of people don't want to move. Change is hard. Moving is just it's difficult. But there are companies that help with that. There are companies that specialize in senior moving. You want to stay in the house that you built. You've been there for 30, 40, 50 years. All the holidays are there, but you may not be able to keep up with all the maintenance. It's too big to keep up with everything. It's too expensive. Pros and cons there. What's the case for downsizing? More manageable of a house. It could cost less money. You still have your independence, but if someone needs help with with taking a shower safely, or at least just having someone there for standby assistance so you don't slip or you reduce the probability of slipping, you still need to go to the grocery store. What happens if your driving is limited at this point? So this is a solution for the right person, and it can be a great solution for the right person, but you still have costs. You may need additional help. And forgive me if I'm speaking beneath what people's knowledge base is. I don't know the needs of our entire audience right now, and so we can have offline discussions that go into greater detail, but I want to create a foundation of knowledge that we can build upon. The next topic, the next option can be to move to an assisted living community. I want to emphasize that assisted living communities are often mistakenly called nursing homes. They are not. They are very different entities, and there are wonderful advantages to moving to assisted living communities, but they may not be for everybody. Some of the reasons that I think are wonderful for assisted living communities are they can give someone a social advantage, an ability to have socialization with their peers that they're not getting at home. We're going to talk in future slides about isolation and how detrimental that can be to one's health and mindset. I think that there are wonderful things about assisted living communities with respect to socialization. There are activities directors that are hired and work full-time at most reputable assisted living communities. They have educations in gerontology oftentimes, or at least understanding the social benefits and needs of seniors, and they know things that they can do for seniors to help engage them, whether they have dementia or not, whether they have Alzheimer's or not. There are great advantages there. Another really strong argument for going to assisted living can be that they have med techs on the floor, and they are there to help make sure that the seniors in their charge are getting the appropriate medications per their physician's prescriptions, and that they are staying on them. Oftentimes when we as a care agency become involved with a family, we can only do medication reminders. And so we can make sure that the medications that were assigned for the caregiver, for the client, are being or we're reminding them to take them at the appropriate times. Whereas the medication, the med techs at assisted living communities are actually able to administer that medication. And so there's an advantage there in helping maintain their medication regime and help, provide a consistency with that. Very important. Now there's a cost to it. And I think further, what people need to understand is the way that assisted living communities are staffed and structured is that they are assisted living communities. They're not complete care communities, right? And so there might be 10, 15, 20 residents that might live on a hallway, and there can be 2 to 3 aides assigned to that hallway. And that's not wrong. It's just what that community is designed for. So if someone needs 24-hour care, they're going to have to hire an outside agency or an outside aide, or the family is going to have to be there all the time to help that person, somebody who needs 24-hour care, and that does happen. And then you have a cost then that's greater than if you just stayed in your house to begin with. So, again, there are pros and cons. It's important to talk with those in the know to help make that best decision for your family, your loved ones. Another option can be move in with family. And if you're like me, you say, oh no, I don't want to do that. I love my dad, and we had a wonderful relationship, and we actually owned a home together that was a duplex, and he lived next door until his passing. And the wonderful thing about that was I was able to be close to him when he had his time of need, and it was great because he got to know his grandchildren better than he would have otherwise. But I see a lot of situations where families don't have the luxury of a duplex type home. He and I had our own separate houses. They just happened to be attached, and he had his kitchen, he had his own bathroom. It's not just an in-law suite, he had a separate place. And that made it tolerable for me. I think if you have to share a kitchen, that can be a little tough. It can get crowded. And there's still a lot of stress that goes along with being a caregiver in that environment, most especially if dementia is a factor. Unless you're trained in dementia, it's very hard to understand what your loved one is experiencing and further know how to handle it. We've dealt with many situations where someone is trying to help their family, and they're frustrated with their parents because they've said the same thing 5 times, or they keep on forgetting where they put something, or they're afraid something is happening, and they're exacerbating the situation by grilling their parents on it when a trained person in dementia and or Alzheimer's may know of a better coping technique, or a caregiver who has been properly trained can help better enrich the lives of that person even more than the family, who absolutely loves them. There's no question about it. So having someone who's trained even in things like lifting techniques, or coping mechanisms, or redirecting and anticipation, can be a great advantage, and also can provide, on the other side, provide a little bit stress for the family when they're trying to manage their own life with their family and jobs too. So great advantages to all of these scenarios. There are challenges as well. I think it's important to work with somebody to best understand how that can be addressed. So in this next slide, it refers back to the isolation that I spoke to earlier, but it gives even more of a description of what it is that we're talking about. This is exacerbated, especially by COVID-19. You're going to see in a later slide, or actually in this slide, that the biggest impact that is a challenge for seniors is isolation. And now with the advent of COVID-19, it's becoming even more of a challenge because people are being directed to self-quarantine or maintain social distance. And so according to this statistic, or the graph that you see, 43% of seniors admit to feeling lonely on a regular basis. Okay, so what does that mean? How does that impact them? Well, of those 43%, 59% are more likely to decline in their ability to perform ADLs, and 45% of those are more at greater risk of dying because of it, through things like preventing from falling or depression. They admit 21% say that they're missing out on activities, social activities that they want to attend, or even they're maintaining their independence or going to the grocery store. And all of these things are things that a caregiver can help with, be it a family member caregiver or a professional caregiver. Caregivers can help with transportation, getting their seniors to their activities, seeing their friends, getting them to an art exhibit or a concert when we're allowed to do these things again. They can help with standby assistance in preventing falls. They can help with grocery shopping and putting food away and preparing meals and cleaning. So the goal is to, again, help enrich the lives of those they serve. Isolation and loneliness is a very, very real issue. Companionship does so much for one's mental well-being, and it gives them help, it gives them hope. I know that we want to have successful engagements. We want happy clients. And the best way to do that is to have them matched with somebody that they love and that they feel comfortable with. And, not every person that walks into your house are you going to feel comfortable with. And so there's a lot of work that goes on behind the scenes of identifying and getting feedback on who is the best fit. And wow, once that happens, once they have that connection with the caregiver, they don't ever want to be without them. And they look forward to seeing them when they come. It's just it's a complete metamorphosis. We have one case where we're doing 24 hours a day with a family, and they don't want anyone but the one caregiver, which is kind of difficult in going 24 hours a day. So we're working through that, but it just speaks to how important it is, to have that connection with somebody, and that they so look forward to having someone that they enjoy being with in their home. Now, so let's move on, and there are more, but I've only got 45 minutes, so I have to be careful on time. Let's talk about how COVID-19 has affected the senior care community. We've talked about the factors prior to it. I think I would venture to guess that everyone on this call is very aware of the global pandemic that we are living through right now. This slide is actually old at this point. When you look here at the top bullet where it says as of March 11th, more than 120,000 people have become infected. Flash forward to May 20th, 2020, yesterday. Globally, nearly 4.8 million cases of COVID-19 exist, with over 318,000 fatalities. It's turned our world upside down. It's shut down economies. It's infiltrated the section of our population that we are most concerned about, our seniors, where we live and work, and need to help them. Obviously, I don't need to go down the list of the challenges that we're facing. I am not a physician, so I cannot speak to the technicalities of the disease. But suffice it to say, those most at risk, as most of us know, are the average age of those people is 56. We all, are aware, I would assume, that a majority of this is occurring in the skilled nursing facilities, or a great number is. And so if I am a senior, or I have a senior in my family, I am certainly very concerned with their well-being. They are, there may be other factors in their health that they are fighting through right now, like obesity, heart disease, diabetes, lung disease. Put COVID-19 on top of that, and their life is at risk. And I don't mean to make that more scary than it already is, but I think we know what it is. So what's the best thing we can do? Prevent ourselves from getting sick. We can try to prevent others from catching the virus by isolation. There's that isolation again. It's saying you need to be, you need to have companionship. You need to have people with you to achieve your best health. But in order to protect yourself from the virus, you need to be, isolated. So where does that put us? Unfortunately, this applies to most of the people that we work with. It puts our seniors in a precarious position, a limbo position. I need help, but I'm at home by myself, and I don't want to cause myself any undue risk. I want to move into an assisted living community, but the assisted living community isn't accepting anyone new right now. That's not necessarily the case. That is for some, it's not for all. I don't want to be misleading in any way. What I'm finding throughout the community is a great deal of the assisted living communities are now admitting new residents once again, but they may have a 2-week quarantine period in place. So where does that put the seniors and their families who need help? Well, if they do move into an assisted living community and they are quarantined, they can hire an outside agency to come in and provide the care for them that the community is not allowed to do during the quarantine period. They can wait at home and get care in the home for just a short period of time until they're available. Or the family might decide that they do want to stay at home just for a certain period of time, or they, and they might need help for just a certain period of time. Maybe they have they just want help just through COVID, and hopefully that abates at some point. We don't know at this point, but there's a gap in care right now for those individuals, and that can be addressed through having care in the home. And again, we could talk about each one of these topics, for a day at a time, but I want to just be succinct in my communications. I want to talk then about, we've talked about now how COVID has affected the senior care community. What is the senior care community doing to provide care with these confines, in light of these confines? So, even before COVID, we've always wanted to do everything that we can to protect our seniors, give them the best outcomes, enrich their lives the best way we can, and not just the seniors themselves, but work in concert with our partner communities and other medical options. And we'll talk about one of those. We've talked about isolation being a factor. I don't need to go into that again, I don't think, but we will talk about how we as a community, not just our organization, but others like us, are turning to virtual assessments as a means of helping reduce the risk. Anyone who signs on for in-home care with a licensed agency is required to have, by the State Department of Health, a health assessment done by a registered nurse. That is traditionally done face-to-face. We've taken to doing virtual assessments where the clients prefer. We can still do them face-to-face, but we're very respectful of families. We've added additional services, such as wellness checks and meal drops and others to try to reduce the risk of cross-contamination, but still get the seniors and our loved ones what they need. There's a big topic around cross-contamination and caregivers going to different locations. In this industry, a lot of caregivers have multiple jobs. They might work in a nursing home and an assisted living community. They might work in an assisted living community and in a care agency. And that's obviously, it presents risk. So we've tried to limit and been successful, in assigning caregivers to certain communities. So those caregivers who are going in communities, and sometimes they're communities that have COVID present, not necessarily the clients that we're serving, but the communities themselves, those caregivers are only assigned to certain communities. Understand, we help people in their homes, but also in communities. And so if we do have communities where we have clients, we're assigning those caregivers specific to those communities. For those clients where we're helping them in their homes, we're trying to establish that consistency in the caregivers so that they have the same caregivers as consistently as possible. Now, it's one of the first questions we get asked in a new engagement: can we have the same caregiver every time? Well, if someone is on 24-hour care, that may not be possible because you're going to have multiple caregivers in, because there's a 40-hour work week. They can only work so long during a day from a safety standpoint. We understand that, but we try to establish that consistency as fast as possible from a client satisfaction standpoint, but also from a reduction of risk, and try to minimize that exposure that they might have. Our caregivers and throughout the community, PPE, you've heard about that, personal protective equipment. That has been a topic, across the country, and its need for it. It was very difficult to get and very expensive to get early on, but that seems the supply chains have opened up a little bit. All of our caregivers are provided gloves, masks, hand sanitizer, etc. We have sent letters out to both families and all of our caregivers with respect to our COVID-19 and coronavirus policies and procedures, and what we're asking of our caregivers. We're asking them to self-monitor with respect to monitoring their temperature. We're asking them to stay home if they feel unwell in any way. We're also asking that of our clients, and making sure that we're all in good communication. We work throughout the entire community. Our partners in home health and hospice and assisted living, they all have their processes as well. It's important to go with a reputable agency or community that will have these processes in place. We're training on universal precautions with respect to how to minimize the possibility of cross-contamination and improving infection control. Finally, there's technology that's available that will enable a family to have communication and insight into their loved one's well-being without having to have a person in the home. And this is something that we can talk about offline if someone has questions. It does not involve the use of cameras, so it's not that invasive, but it does provide important data that can be distributed electronically, which can be, again, we can talk about if anyone has a need or an interest. Finally, the last topic, and one that's very relevant to everyone, is, well, not everyone, but most, is how much does this cost? Everyone, a lot of people want this type of care. A lot of people need care, but the question then becomes, how do I pay for it? And there are several different options. I don't want to get too basic on it. I don't want to go down in the weeds on it, but each one of these is its own topic. I'll talk briefly about the difference between Medicare and Medicaid, and where supplemental insurance plays a role in this. Long-term care insurance is a wonderful asset to have, but it can be confusing, so it's important to work with an expert that understands it and helps you use the benefits that you have. We're very proud to be a preferred provider for the VA benefit. My father was a veteran. We do about 20% of our business serving our veterans. It's very important that they get everything that they're entitled to. We appreciate their service and want to make sure we're doing our best by them. Obviously, cash and assets are another option too. I want to be careful about time, but just so we can recognize some of the industry acronyms, I can't assume that everybody knows all of these terms, but ADLs activities of daily living. What this equates to are things that become difficult as we get older: cooking, cleaning, bathing, dressing, grooming. These are all things that people may need additional help with. SNF, skilled nursing facility. Oftentimes, we're talking about people use that interchangeably, and they call it a nursing home. That's fine. Now, CM, case manager, DP, discharge planner, SW, social worker. Oftentimes, those are interchanged. Now, social worker is a very specific certification and education level, but a social worker, who I love them, I love what they do. It's so easy. They are your friends. They are your advocate. They are helping your loved one navigate and getting the right options in place for them as they're being discharged. So whether they are functioning as a discharge planner and or case manager, they're coordinating the care once they leave the hospital or the skilled nursing facility. They're giving you recommendations on what may be best for your loved one or for yourself as you go into the unprotected world of from the hospital. But people don't want to be in hospitals right now because of the risk for disease. No one really wants to be in the hospital, but they're more at risk and they want to get out as fast as they can. And so, are you going to need DME, durable medical equipment, when you discharge from the hospital? Do you need a hospital bed? Did you break a hip, or did you have a stroke and you can't go up to your second floor bedroom, or you need to be elsewhere in the home? Do you need skilled care? Do you need physical therapy, occupational therapy? They can help coordinate that with a home health agency. Is hospice a better fit? But even still, with all of that, someone says, well, I have home health, I don't need anything more. Well, if I have physical therapy or occupational therapy, maybe my therapist is coming in 1 hour a day, 4 days a week. What do you do with the other 23 hours? But maybe you don't need a full 24-hour care. Maybe you only need about 4 hours of care a day, a couple days a week. There's every option in between. And then we can talk about LTC, that's long-term care insurance, AL, assisted living. Oftentimes people interchange assisted living for nursing home. It is not. It is very different. And it's more like an apartment. We'll talk about that a little bit with care options. Independent living, similar to assisted living without the care, but designed for seniors. So first question is, does Medicare pay for this? And I will say that traditionally Medicare has not paid for non-medical care. So non-medical custodial services, if you see on the right, is what we work in the most. If you look at the bottom, 95% of discharges require non-medical services, thus falling under private pay. And that's where we come up with the other options. Medicare can cover hospitalizations, skilled nursing facilities for a certain number of days, skilled nursing intermittent visits, hospice, palliative care, durable medical equipment, things that we just spoke about. So let's break it down a little bit further. Home care and custodial services, we just talked about. This is the care that we're talking about when you have aides come to your place of residence. Independent living would be senior focused apartment-like complexes. They don't have caregivers provided in the community, but you can bring in caregivers from outside. Could be family, could be a hired agency, could be skilled care. There's usually community dining in independent living communities, and they are designed around the specific needs of seniors. They try to make them as risk-free as possible, with limited steps, elevators, wider doors, etc. Assisted living communities can look much like a regular apartment community, but they will provide caregivers that can help with activities of daily living, additional help. Care homes are a version of assisted living, but can reside in just a normal neighborhood. People call them board and care, where maybe you have anywhere from 3 to 6 residents that live in a residential home that's staffed by 1 to 2 aides. So people might want a more intimate environment rather than a bigger assisted living community. Assisted living communities come in all different sizes. What's the difference between Medicare and Medicaid? That seems to be understood, but just specifically, we get these questions a lot. Medicare is something that all working taxpayers pay into and benefit from. Medicaid is a program reserved for those that meet the financial poverty level or disability requirements. So for those that qualify for Medicaid, Medicaid can pay for home care, but you have to be on Medicaid, and not all agencies accept Medicaid. There is a movement toward Medicare Advantage where CMS, the governing body of Medicare, in the last year and a half has authorized payment for certain aspects of home care through Medicare Advantage programs. That is something that I would speak with your Medicare representative or your Medicare Advantage representative about, to see if your care is covered through that policy. Not everybody has a Medicare Advantage policy, but everybody does over the age of 65 have Medicare. So what are these other funding sources? Long-term care insurance. It is such a wonderful asset. It's expensive though, and so only about 20% of the families that we've come across has this. If you have it, use it. It's something that if you don't use it, you will lose that benefit. People who get care reduce the probability of falls, and they have a better opportunity to stay on their health regime and can stay healthier longer by having additional care. The reason people don't do that a lot is because A, they don't want to give up their independence, but they may need the help and they don't want to pay for it. But if you have long-term care insurance, use it. Get the care that you've paid for all these years. I said 20%, the graph says 10 to 15%. I was speaking specifically to our mix, our client mix in our Richmond and Williamsburg locations, so forgive me if it seems that I misspoke. Long-term care insurance can be complicated. It can be confusing if you haven't worked with it before. Most have elimination periods. Elimination periods are essentially a deductible of time that you have to pay out of pocket before the benefit kicks in. Things need to be known, such as what is my maximum daily limit? What is my lifetime benefit? Is there an inflation rider? Has that benefit increased since I started paying on the policy 20 years ago? Is there a waiver of premium? Can I stop paying my premium once I start receiving benefits? So basically, there are a lot of moving parts. You want to work with somebody who's versed in this space and can help you with that, who can advocate for you. Even something that that should be simple is not how do I open a claim? How do I make sure that my claim is going to be accepted? We can talk with you about these things. Moving on to the topic of veterans, you heard my position on that. I'm very glad that there are benefits and processes and policies for them. Specifically, there's a program called the VA CCN, the Virginia Veterans Affairs Community Care Network. This is a program where veterans are able to get care at home through a third-party agency, and the VA system pays the third-party agency directly. We work in this. We think it's wonderful because the veterans are able to get the care or some care that they need. It doesn't always cover everything, but for those veterans that qualify, it's great. There's also something called the VA Aid and Attendance Benefit. This is a benefit for our veterans who qualify and it basically is a reimbursement for the non-medical care that they need. So there are people and companies that exist that are experts in helping you with that. We can connect you with those people. There are certain qualifying parameters that need to be met. They can help with that. and I think it's just a wonderful benefit. These numbers have changed over the years, but basically you're talking anywhere from $1,200 to $3,000 per month that can be applied to care for those who benefit. Again, we can connect you with the resources that can help you best with knowing if you qualify and then helping you with that application. There are other funding avenues. There are companies and experts who specialize in reverse mortgages, so using the equity in your home to help pay for the care that you need. There are companies that can help you convert your life insurance policy, if you have one, to paying for the care that you need. They are trained specifically in this. This is not our area of expertise, but part of our responsibility in the community is to connect you to those people that can help you best, and our partners would do the same thing. I know they will. I've known them for years, and the more knowledge you have, and we as a community have, the better we can help the specific needs of those that we serve. So we're coming to the conclusion of this presentation. I just want to review what we've covered. We've talked about the factors impacting the senior community. That was before COVID, what some of those senior care options were, the pros and cons of them, the advantages, disadvantages, and you just need to talk them through and understand what they are. How COVID-19 has affected the world of senior care, and how the community has adapted to try to minimize risk and keep our seniors safe. Finally, we talked about senior funding options for seniors. We can help you with this in care coordination, virtual assessments, helping keep seniors safe in that transition or any type of limbo period, staffing services to our partners, which we've received several calls with. Right now, it's been hard to get caregivers. Many of them might be self-quarantining, or they have children at home, which doesn't make them available. So these are factors that are affecting the other side of the business, and we all need to work together as a community to help each other. We can work, help with financial care coordination. We do help with placement services. So if you are looking for the right assisted living community or independent living community, we have expertise in those areas and know the options in our respective communities where we work. And of course, we're happy to help connect you to the right home health company or hospice company, palliative care company, skilled nursing facility. We know people that have ramps that can put ramps in your homes. We know people that can help with, the aid and attendance benefit or the life insurance conversion. So, we know basically anything that affects a senior, we will try to get you to the right resource. So again, my name is Jay Mann. I appreciate your time and consideration. We're close to, ran just a bit over. We'd love to stay in touch with all of you and learn more about your businesses, what you do. If there's anything that we can do to assist you or your clients during COVID-19 or beyond, please don't hesitate to reach out. We're on Facebook. We have a newsletter that we'd be happy to share with you, or just pick up the phone, give us a call anytime. Whether you use our services or not, we are here to help and be a resource for you. I thank you for your time and consideration. This will be recorded and saved to review or send at your later convenience. Thank you. I'm going to open it up to questions now, and I'll let Karen shepherd those if there are any questions from the community.
Well, Jay, at this point, there's nothing on the chat. I think you've done such a comprehensive presentation here that you've covered everything that we need to know.
Well, I don't know if that's always the case, but if someone wants to chime in right now, please feel welcome to do that. If you don't, you want to call me or Karen later, the numbers are on the screen. My email is on the screen. We are here to help. Just let us know.
Hey Jay, this is Tina. I do have a question that I'd just like to share with the group, and I'm not sure if other people get this question, but I often have gotten this question before, is what is the turnaround time when a family or a community realizes that they have a need? What is the usual turnaround time to get placement?
It's a great question, Tina. We get it all the time. This world moves very quickly. It is not uncommon for us to get a call at 3 o'clock in the afternoon for someone who's discharging and didn't know that they needed help at home and need staffing that night. We can most often staff same day. Obviously, the more notice we have, the better, because we want to identify the right caregiver, the best fit. But with the team that we have in place, we can usually staff within a short amount of notice. Obviously, the more notice you give, the more we can try to secure a consistent schedule.
And do you have a time minimum requirement?
Our time minimum, we used to have a time minimum until we became a preferred provider to the VA, and they said that we would do 2-hour shifts, and we said thank you. So it has gone from 4 hours down to 2 hours. Our time minimum is a 2-hour engagement. We are doing those. We are doing some specialty drops now, for meal drops and some other one-off situations. But by and large, we'll do 2-hour shifts. We can help with transportation type cases or getting somebody to the doctor's office, and that usually is a good use of that.
Okay, and Jay, we did get a chat question. This is from Mr. Legaspi from Leo. He says, do you provide care for younger citizens who need help with ADLs from an accident or an illness?
Another great question. The answer is yes. We focus on senior care because those are generally where we're finding those that have the most need for their help with the ADLs, but we have had instances where we've helped younger children who have limited capacities, or someone who has a sickness or is recovering from a surgery. And yes, the answer is if someone needs help with ADLs, we will help them regardless of age.
Fantastic.
Great. Well, again, I thank everyone for your time and consideration. I'm going to put a stop to the recording, and I'll sign off. Have a great day, everyone. Stay safe. Best wishes as we navigate this unprecedented time.